Hello, my name is Emily Miller, and I am doing this presentation for the care and prevention of athletic injury. I'm doing my presentation on male ice hockey. I took my stats from the Ontario Reign hockey team, seeming as though this is my favorite hockey team. So the average age for this team is 24. Their average height is 6'1", and their average weight is 198 pounds. Injury factors include levels of participation, so if they're out on the ice more, then they're more likely to get hurt. Another factor is player position, so if they're in a certain position, then they're more likely to get hurt than if they're a starter or something like that. If their protective equipment isn't on right, if their shirts aren't tied down, if their helmets come off like in fights, which brings me to my next point, violent behavior. A lot of hockey has violent behavior. There's a lot of fights that go on, and just there's a lot of violence between the two teams, which I think is what makes it the most fun. Pre-existing injuries. So if the hockey player already had an ACL tear, then he's more likely to get another ACL tear or another knee injury of some kind. So the first injury that I want to go over is a acromioclavicular separation. So there's a couple different kinds or types, levels of separation. So the first is a mild separation, which is a sprain of the acromioclavicular ligament. It looks normal on x-rays, and it doesn't move the clavicle at all. So the second stage is a little more serious. It is a tear in the acromioclavicular and coraclavicular ligament. It puts the clavicle out of alignment and causes a small bump on the skin. So it'll be noticeable if you have the second stage of an acromioclavicular ligament tear. And then the most severe is a complete separation of the acromioclavicular ligament, and this is a and the coraclavicular ligament, and it completely dislocates the acromioclavicular joint, which causes a large bump on the skin. So this is just a picture of where the injury would occur, so the acromioclavicular ligament, and then it shows the clavicle and the scapula. A way this injury occurs is a fall directly on the shoulder, which is very common in hockey. You may trip on the ice, another player may trip you. It just depends on what's going on in the game. So the second type, or the second way that this could happen, is a blow directly to the shoulder, which with violent behavior is also a very common injury to happen. So the acromioclavicular joint is made up of the lateral end of the clavicle and the acromion of the clavicle. So when the injury is on the more severe side, so when it's a lot worse, it is easy to identify because of the deformity it causes. You can easily see that there's a deformity. When the injury is on the less severe side, it is very hard to identify. So that's it's a bad thing that it's hard to identify, but if they can't identify it right away, then you're pretty much good. But an x-ray is needed. So a way to test this is the crossover impingement test. So you're going to have the patient lying in a supine position or sitting. So you're going to place one hand on the posterior aspect of the patient's shoulder and the other hand on the patient's elbow. And then you're going to stabilize the patient's trunk, so make sure that their trunk is stabilized. And then passively and maximally horizontally abduct the shoulder that is, or adduct, so adducts the shoulder. So a positive test would be there's shoulder pain, anterior shoulder pain, posterior shoulder pain, some type of shoulder pain would mean a positive test. Now some rehabilitative exercises for acromioclavicular separation is the weighted pendulum stretch. So you're going to do 1 to 2 sets of 8 to 10 reps. 2 to 3 times a day. And then a progression is after a week. So after 1 week, start adding weight by 1 to 2 pounds, and then gradually increase the diameter of movement and the weight. However, the diameter of movement should not exceed 18 to 24 inches. The second rehabilitative exercise is called a doorway exercise. You're going to do 1 set of 3 repetitions, 7 days a week, and then the progression is as tolerated, stretch your shoulder more to increase the range of motion. So the weighted pendulum, I have a video on that on YouTube. So the next one is a preventative exercise. This is internal rotation. So you're going to do 2 to 3 sets of 15 to 20 repetitions, 4 to 5 days a week, and then increase the strength of the exercise band. Now the next one is arm raises. So you're going to do 3 sets of 10 repetitions, 5 to 7 days a week, and then you're going to increase the weight of the dumbbell as you go. So the next type of injury that is often found in hockey players is a broken clavicle. This is due to the violence that is found. So, and then this is in the shoulder. So ways that this injury occurs is it's caused by a direct blow to the shoulder, which is very easy when you're either going on the ice, you're skating down the ice, you run into somebody purposely comes and like knocks into you. Different ways this can happen. And the second one is a fall directly onto the shoulder. So whether you're skiing or whether you're skating and then you fall directly on your shoulder, you slip, somebody trips you, which again is very common because of the violence found in hockey. So the clavicle, if it's broken, it usually has a deformity on the skin. So you can feel it, but an x-ray has to be done in order to confirm a broken clavicle. So you can't just look at it and say, oh yeah, broken clavicle, even if it might be very easy to look at and say that. So a test that can be done is a drop arm test. So you're going to fully abduct your arm so that you lift it out to your side and above your head. Then slowly and with a controlled motion, return it back to the side. Now, difficulty in producing a smooth movement with the arm dropping back to the side. So if they can't control it coming back down and it just drops, and pain on returning the arm back to the side indicate supraspinatus muscle injury, which could be a way to check for clavicle injuries. But the easiest way is to look at the deformity on the skin, and you have to have an x-ray in order to make sure that it is a broken clavicle. So the next one is rehabilitative exercises for broken clavicles. So supine external rotation is one way. So you're going to do 2 to 3 sets of 10 to 15 repetitions, 7 days a week, 4 to 5 times per day. So a progression of this is you start at 0 degrees for 1 to 3 weeks. And then as tolerated, you're going to move to neutral for weeks 3 to 6, 90 degrees adduction, week 7 to 16, and then full range by week 16 to 18. Now the next rehabilitative exercise is rowing. So you have 2 to 3 sets of 8 to 12 repetitions, 7 days a week, 1 time per day. So progression is you're going to go from prone to seated to standing. And then preventative exercises is to have a good training, strength training, and stretching routine. So one of the strength routines is bent arm lateral raises. So you're going to do 1 to 3 sets of 10 to 15 repetitions, 2 to 3 days a week. And a progression of this is start on a balanced surface, such as a chair, Then you're going to move to an unbalanced surface, such as an exercise ball. And then finally, you're going to do this standing on one leg. The next preventative exercise is high to lows. You're going to do 3 sets of 10 repetitions, 5 to 7 days a week. And then a way to progress this is you're going to increase the strength of the resistance band. The final injury that we're going to go over is strains and tears of the ACL. So there are different levels to an ACL sprain or tear. The grade 1 tear is the least common when it comes to the ACL tears. They're usually near complete or complete. So grade 1 sprain is where the ligament is only mildly damaged. The ligament has been slightly stretched and is still able to stabilize the knee joint. So with some exercises, you can get that back to working just as good as it was before. So grade 2 sprains stretches the ligament enough to where it becomes loose. This is a partial tear of the ligament. And then grade 3 sprains is a complete tear of the ligament. This means that the ligament is split in two and the knee joint is unstable. So this is a picture of where the ACL joint is. So the acromioclavicular ligament, it's not a joint, it's a ligament. So it's just within the knee, right next to the menisci. So mechanisms of injury for this is fast twisting. So when the puck goes one way and then it goes the other, you're going to twist and go after the puck. So that's a very easy way of, you're just playing your sport and you go fast and you tear your ACL. Another one is direct blows, which is very common, whether somebody's skating towards you and they accidentally hit you. They could be high sticking and hit you with the stick in the knee, make you lose your balance, or it could be high sticking and it comes directly at your knee, to like the side of your knee or the front of your knee, and you tear your ACL that way. So a way to test this is the Latchman's test. This is where the athlete is on their back, their injured leg is relaxed, so you want to make sure that it's completely relaxed, and then the examiner holds the leg with the knee bent at 30 degrees of flexion. So with one of the examiner's hands on the athlete's thigh, so you want one of your hands on the athlete's thigh, you pull forward on the calf. If there is a tear, there will be an increased forward motion and a soft endpoint when compared to other knees. Other tests include the pivot shaft and the anterior drawer test. Rehabilitative exercises for this is the leg press. So you're going to do this 3 times per week, 2 to 3 sets of 15 to 20 repetitions. And a progression for this is to increase the amount of weight pressed. The second one is the hamstring curls. You're going to do 2 to 3 sets of 10 to 20 repetitions, 7 days a week, 1 time per day. And a progression is to go from the prone position to a standing position. One of the preventative exercises for this is body weight squats. So you're going to do 2 to 3 sets of 10 to 20 repetitions, 3 to 5 days a week. So as tolerated, add an exercise band, and then increase the strength of the exercise band as you go. And then the final preventative exercise for ACL tears is walking lunges. So you're going to do 3 sets of 10 repetitions, 3 to 5 days per week. And then to progress this further, you're going to go into a deeper lunge. That's all. Thank you for listening to my presentation. I hope you have a great night.